Thank you. Welcome, and thank you for your warm welcome. It's very nice to be in Sweden and your beautiful city of Stockholm. Talking about vitamin C it's an interest of mine, the vitamin C. Many of you may know that my primary interest is in the topic of vaccination. However, in the study of vaccination, what I have realized along the way is that much of what I learned in my medical education was lacking in details on how to support the biology of the human being. Mostly it was designed to suppress symptoms and to drugs that start with anti. So that tells me a lot. Now these drugs, as you know, they work very well that we can use in allopathic medicine, and when somebody's dying, they can come in very handy. But when people are just a little bit sick, or when they are healthy, as you know, it can be very helpful to support the chemistry of the body using the design that it was designed and the earth products that were put here for us, and not the products necessarily that the drug companies have made for us. So since I've learned to use vitamin C, I found that not only has my own health become extraordinarily better, but my prescription writing has gone down significantly. And the health of my patients has also improved greatly, because vitamin C does so many things from the time that we are conceived, actually, until the time we die. Vitamin C is necessary for so many processes. And I will present to you some of the current research that supports the use of vitamin C even in the sickest patients that are in intensive care units. This just came out this year in 2014. There is a lot of mythology in the conventional medical realm that trickles down and moves into society. And this mythology is mythology that I used to believe, and that is that vitamin C is, it's necessary to prevent scurvy, but it doesn't really necessary to be given in any higher doses than we get in our food necessarily today. Well, I found this not to be true, not only for my patients and for myself, but the medical literature and some alternative literature really supports that these myths are actually not true. One of the myths that you'll hear often from conventional doctors is that doses over 1,000 milligrams are dangerous and wasteful and just gives you expensive urine. We hear that the body becomes saturated if you take 150 milligrams, so no use taking any more. We hear that kidney stones can be a big problem, and we have to be on the alert not to develop kidney stones. We hear that there is no science behind high ascorbate use, despite the fact that Nobel Prize-winning scientists have shown that there is science and there's ongoing science for the use. We hear often that natural whole vitamin C is always the best thing to be used. Now, food is always the best thing to be used first, but when you're really very sick, you will not get enough vitamin C from your food. Okay, I'm here seeing nods. So, and the other thing is that we can get diarrhea from high doses of ascorbate, and we hear that this is dangerous and we can kill little babies and cause bowel necrosis. None of this is true. None of this has ever been proven clinically or scientifically. We also hear that you can get enough from food when you're very ill, and that also is not true. Okay, so I just want to emphasize that simply preventing scurvy is not the same as promoting optimal health. These levels here that they're telling us is for preventing scurvy, and they're still rather inaccurate, because if one is to develop, say, influenza or whooping cough, those reserves can be depleted very rapidly. Okay, so I looked around to see if anybody studied the levels in the blood of vitamin C in people and what it is. And I found this study from Canada, and they looked at people who were coming in and out of hospital to have their blood drawn. So they might be a little bit sick because they're probably, getting blood tests. But this was what they found, is that 84% they said was normal. this 23% they said subnormal, and only 11.4% they called deficient. Now, what they call normal, I don't call normal, because they're calling greater than 28.4 normal. I believe that 100 to 125 is probably closer to normal, and I'll show you why in a minute. So I think more than this is actually walking around with low levels. But let's look at the difference now in patients who are in hospital and ill. What we find is that there's much more of them that are subnormal, 60% subnormal. 19% are called deficient, which is very, very low level here, 11.4 micromole per liter, and only 21% considered normal by their very low standards. And if we look at this graph at the bottom, it shows that the hospitalized patients are the black bars, and the outpatients are the clear bars. And you can expect some overlap. But what I want to point out is that both of these groups had some people that were up around 100 or 125. And this, in addition to other literature that I have read and the dynamics of vitamin C in the body, is what leads me to say, I believe this is a better range for us to live in. 100, 125, even 150 is easily possible with repeated, either high diet with this nutrient or with repeated doses of various forms. So this study concluded and said that nearly 1 in 5 had plasma vitamin C concentration consistent with scurvy. And even more disturbing to me was that 24% of these people, when they went into hospital, were taking vitamins, and doctors discontinued most of it when they were admitted to hospital. So I wonder to myself now if conventional doctors even knew about this, if they would do anything about it, because we still are living with this myth that we don't need to look at vitamin C levels in sick people and we don't need to supplement, although that is changing. But there was a doctor, even back as far as 1950s, who had a rather interesting comment to make about his colleagues. This is Dr. Frederick Klenner, who was one of the pioneers of using high doses of ascorbate, and he cured many of the most atrocious diseases in the 1950s, including polio, and this black widow spider bite, which he gives a detailed case history. And in this case history, he says that there are some physicians who would stand by and watch the patient die rather than use this vitamin C, because they're still thinking that it exists only as a vitamin. And it is much more than a vitamin, and I'll tell you more about that in a moment. So there's another interesting study here, because it basically just works with food, with some kiwi fruits. And this is a study from New Zealand, and they got some adult males around 30 years old, healthy, and they wanted to see what the vitamin C levels in the muscle were. So they volunteered for this horrible muscle biopsies, but we got some interesting information. They started by just measuring their levels, their blood levels, and they found that they're pretty much on the low end of normal. 30 to 40 was their range when they started. Then they said, just consume a diet low in vitamin C and stop supplements. And look, it dropped down, within 5 weeks, dropped down almost to levels of scurvy. And then they said to half of them, you take 1/2 of a kiwi fruit per day, and the other half eat 2 kiwi fruits per day, and then we'll see what happens to your levels. And interestingly is that they were able to rise these levels fairly high just with 2 kiwi fruits per day, up to 70. And even the half kiwi fruit had a pretty good effect in the muscle. Okay. Now, mind you, different parts of our bodies need different amounts of vitamin C. The adrenal gland and the eye need very high amounts, for instance. Muscle is somewhere in between. So this is just an interesting study that shows you that if we did eat a minimum of 5 fruits and vegetables per day that has vitamin C in it, that most of us could have pretty good levels, assuming they're not sprayed with pesticides and they're fairly fresh and we're not smoking and being exposed to dangerous chemicals. So you can divide the need for vitamin C into 2 categories. And it can be the everyday needs, like detoxifying chemicals like car fumes, like preventing damage from environmental sprays, or from any poison, because vitamin C acts as an electron donor. And what those electrons does is fixes the damage that's done by these oxidative stress. And I'll give you more detail about that in a moment. So that's why vitamin C is called antioxidant. So it can protect people from pollen and allergies, also by acting as an antihistamine. This is very well established in conventional medical literature, that high histamine levels equals usually, almost always, low vitamin C levels. When you give vitamin C, histamine drops. I found clinical practice and evidence in medical literature that in instances where there's allergic reactions and histamine, vitamin C is very, very valuable and does not have the side effects as most conventional antihistamines have. It is also a cofactor for many enzymes, some of them that make collagen, that make neurotransmitters, hormones, and this carnitine molecule, which we need in order to make use of fat that we eat. There are two medical issues that fill most doctors' offices, whether you're alternative medical doctor or conventional medical doctor, and these two medical illnesses filled my office almost exclusively, and those were diabetes and high blood pressure. Okay, and both of them are associated with low vitamin C, and both of them respond to various degrees depending on the person and the dose of vitamin C, but respond well to supplementation. Both types of diabetes are becoming worldwide problems, epidemics, and both of them are largely preventable. And we also know that diabetics have lower vitamin C levels than non-diabetics, about 30% lower. Even if you're a very well-controlled diabetic, diabetes is an inflammatory state. So we find that just about every aspect of glycemic control is improved with supplementation with vitamin C. Okay, heart disease is the other one. Now, heart disease is another problem. It's caused by too much oxidative stress, toxin exposure, toxins both from inside the body and from outside the body. It's an inflammatory state. And when it affects the heart, it's basically one area in the heart that becomes really sick, but it's happening usually in the entire body. And again, every risk factor for heart disease is amenable, meaning improved, by vitamin C. So we know that blood vessel health is improved because blood vessels are like layers of bricks and mortar. And you cannot make that mortar without having adequate amounts of vitamin C. And you can have just an area in your heart that has scurvy, even though your blood levels may be normal. And we know this from biopsies that were done in the 1950s, where they looked at these people who had heart attacks and strokes, that they find parts of the brain and the heart that are extremely low of vitamin C. And they're usually parts that have a lot of stress acting on them. Cholesterol and high blood pressure, all of these things are improved. There's adequate literature for you to look at. The physiology is known about how the vitamin C works. And so really the only thing that there hasn't been a whole lot of research on is exact dose. But when it comes to vitamin C, I believe that most people have to figure out what their own dose is. That it is not the kind of thing that I can say, every person with high blood pressure should take X amount of vitamin C, because we all have different deficiencies and changes throughout time. Here is a book if you want to learn more about the heart aspect and the blood vessel aspect of vitamin C. This is written by a doctor named Thomas Levy. He is a cardiologist, and he is also an attorney. And his viewpoints are very well backed by scientific literature. He has, in this one, I think, over 650 scientific references. And so it's a very valuable book that describes exactly how these changes in the heart and the blood vessels are affected by vitamin C and why. Well, here's how the damage happens. This is, just imagine this is a cell of the body, and this is the nucleus, and this is the nucleus here, with the DNA, and here's the mitochondria, which makes the energy for the body. And so we have all these things with squiggly lines that are coming in and bumping electrons out of the way. Okay, we're made of energy, basically. Our bodies are made of energy that has basically electrons, protons, neutrons, and it's just arrangement of these things that dictates the chemicals and the function. Okay, so if you knock an electron out of its place in the body, it's kind of like ever play musical chairs, where, so there's one that's missing, so everybody's fighting for the last one. And that's exactly what happens with oxidative stress. Well, that's what happens. It's like a chain reaction in the body. If an electron gets bumped away, the molecule that's missing that electron will always be searching for it, another one. And when it finds it from another one, that one will go looking for another one. Vitamin C can stop this chain reaction, and it can also improve the damage that has already been done by this chain reaction. So classic chain reaction is electromagnetic energy from the sun. It can bump this electron away. Then we've got the inflammation from microbes that basically when your immune system attacks them is one way that we can have the stress. And also these microbes, they secrete toxin often, like think of rheumatic fever, think of meningitis. These are both examples of viruses and bacteria secreting toxin. So they will also cause oxidative stress. Even emotional stress. If I were in a car accident, the stress that imposes upon me, even if I have no infection, is the same as far as oxidation as all these other things. Emotional stress, physical stress, all impact similarly. So we have also chemicals. Then we have antioxidants from food that can help. Drugs, pharmaceutical drugs, are some of the worst culprits of oxidative stress. And then just our regular eating. So having some oxidative stress is you will always have. But we have built-in mechanisms to deal with that. It's only a problem when your built-in mechanisms and your food isn't supplying the electrons that you need to help with this damage that's been done. So the damage can damage proteins, it can damage mitochondria, and it can damage DNA in the cell. It can damage the outside of the cell and can be a big problem. So overproduction of these free radicals, free radical is something that's missing an electron. It can cause damage to the nerves, to the proteins, to the DNA, the mitochondria, and the fats, the lipids. And it can lead to all these diseases that we commonly hear about: atherosclerosis, cancer, diabetes, rheumatoid arthritis, heart disease, chronic inflammation, strokes, septic shock. And this is just naming a few. So vitamin C can help with all these different diseases. There are two groups of antioxidants. Some act as enzymes, and you've probably heard of glutathione peroxidase, you've heard of glutathione. Others are non-enzymatic, and vitamin C is called non-enzymatic. And vitamin E is also non-enzymatic, electron donor, lipoic acid, and things like that. You can get these from food. So these all help dampen down the inflammation that's caused by oxidative stress. So while vitamin C can prevent the damage by interrupting the chain reactions, these flavones, which is part of what you get in food, in the whole vitamin C, these flavones will chelate out metals and toxins, and so that makes the vitamin C have a more powerful effect. Now, for pregnant women and babies, the concentration of vitamin C in the body is very important, and that's because our cells cannot divide without vitamin C. We can't make skin, we can't make connective tissue, we can't make bone or cartilage without vitamin C. It's extremely important to a developing fetus, and it's so important to the fetus that it will take whatever it needs from the mother, even if it means she becomes depleted of vitamin C. So the baby will have, in the placenta, will have twice the amount as the mother in general has in her blood. The cord will have twice the amount. The baby will have twice the amount. But the amniotic fluid that the baby is bathing in and is swallowing as it's making its intestines grow longer has 3 times the maternal amount. So it's extremely important that mothers are getting plenty of vitamin C in the diet. And there are many doctors that think that mothers should also be supplementing while they're pregnant. In addition to that, vaginal delivery and labor uses extraordinary amounts of vitamin C. And we find that the levels drop in the mother after the delivery. The birth is an extremely stressful process, but it's a necessary stressful process. Nature thought of everything. There's always backup plans and always plans to reverse oxidative and inflammation states when they occur. So this is a very interesting article. By the way, you'll see these numbers at the bottom of my slides. If you go to a website, pubmed.com, pubmed.com, and you put these numbers in, you'll either get the abstract or the full text of these articles that I'm talking about, okay? So this was a very interesting article called The Stress of Being Born, which I highly recommend reading, only because it's just so fascinating. And I'm just taking a little piece of this to show you that this is catecholamine levels. A woman during delivery has, moderately high catecholamine levels. This is a man who is exercising levels of catecholamine. This is a tumor called pheochromocytoma. It's a very dangerous tumor. It causes dangerously high blood pressure, can cause strokes, and has to be aggressively managed and sometimes removed. And just touching it upon removal can be life-threatening because the levels of catecholamines are so high from this tumor, okay? Well, the baby, when it's born, is even higher than this tumor as far as catecholamines. So these high catecholamines have a purpose. It stimulates and basically jump starts the immune system. It basically clears the lungs out of that fluid. Think about when you are stressed out, what happens to your mouth? It gets dry. Catecholamines will help dry all those mucous membranes so the baby's lungs can function normally. It also helps the baby deal with the low oxygen level, which all babies have when they're born normally. So this is a normal part of birth, but it's very inflammatory, and there are ways to deal with this. Now, that's one of the reasons why mother having a good level of vitamin C and diet high in vitamin C is important. But there's a problem that can happen if the baby's antioxidants aren't high enough, and that is this problem that we see here, which is jaundice of the newborn. We're told that 60 to 70% of babies today have this, and it's treated like a disease when, from my research, I really believe that this is preventable. And from my discussions with women who have supplemented with vitamin C, I think it's in my anecdotal understanding. But there's actually research that supports this idea. And that is that bilirubin is second only to vitamin C in its power to be an antioxidant. Bilirubin is a very strong antioxidant. Now, if bilirubin levels are too high and the brain is open and albumin levels are low, you can have encephalitis. And that's the big concern about having babies have high bilirubin. But I'll tell you that babies can have encephalitis even with lower levels of bilirubin, and they cannot have encephalitis even with higher levels of bilirubin, because it's much more complicated than just this tunnel vision that conventional medicine has. High bilirubin equals danger. It's not so simple. Well, I searched the literature because I thought somebody must have looked at this at some point. And there was an Italian article from 1957, which I had somebody translate for me. And you can get this article here yourself. And this doctor, Garbelli, he got 89 pregnant women during their first trimester, and he gave them 1 gram of vitamin C every other day. And then he looked to see who had jaundice when the babies were born. And what he found is that 61% did not have jaundice. So it's completely the opposite of what we are thinking is normal today. Mild was 24%, moderate 3%, and in every experiment there are going to be some people you just don't know what happened with. So to me, this is very interesting and shows me that women, I believe now, pregnant women should be taking at least 500 milligrams of vitamin C per day. But I happen to know dozens of women now who have taken between 5,000 and 6,000 milligrams per day. And I know that Dr. Klenner was giving much higher doses of that in pregnant women in the 1950s. And he was even giving a bolus dose at the time of delivery between 10,000 and 15,000 in an injection. And all he had was good deliveries and no problems in his cohort of patients. And he's written about this. And again, this is all literature that you can find online. Well, because we have this problem of bilirubin in babies, the solution is to put these babies under a blue light or put them in the sun. And it does work. It does lower the bilirubin. But the question is this the best approach? Or is this just an approach like allopaths like to do, which is to get rid of the symptom, even if the baby is less healthy in the end? Well, there's evidence to say that that's exactly what's happening. And that is that they looked at these babies, at their antioxidant levels after being put on these blue lights. And while the bilirubin levels did go down, the albumin levels went down too. And that's not good because you want bilirubin to be connected to albumin, and that keeps it out of the brain, okay? They also had lower glutathione levels, and it lowered their vitamin C level. So the question is, are we doing these babies really any big favor by putting them under blue light just to satisfy the fear of the doctors who don't understand the physiology of hyperbilirubinemia? That's for you to answer. Okay, now let's move on to other things that the vitamin C can do. This has to do with structure and integrity of the physical body, and especially bones, which we cannot make without vitamin C. The eyes are very specialized organs that are extremely high levels of vitamin C are stored. Skin, tendons and ligaments, and then the blood vessels, which I talked to you about already. As you can see the layers of cells that we have here. And if you look in there, you can see it's like bricks all lined up. And it's a glue that holds these bricks together that can come undone in times of low vitamin C. So when you hear somebody has an aneurysm, low vitamin C. When they look at these aneurysms, when you hear someone has a cholesterol plaque with inflammation, it's low vitamin C. So anything, the splitting apart of these layers is what we call atherosclerosis, or what we call aneurysm. So these are both conditions that not only do we find focal areas that don't have enough vitamin C, but that can be improved by taking very high doses. So in brief, I'm just going to show you how this works as far as collagen, because it's very interesting. If anybody here knits or has ever been a spinner to spin threads, you know that you start out with the threads and then you have to spin the threads together to make it stronger. Well, collagen is the same. Okay, so here we make this collagen, but then we have to weave it together. And for each OH you see there, one molecule of vitamin C is used. So you can imagine enormous amounts of vitamin C are used in order to make collagen. And then it's woven together like that. And then they're put in even the big fibers. So this is just basically your raw yarn. And now you want to take the yarn and make something with it. And that's what's happening here. This is basically what's happening with the knitting for the bone. And then in between these fibers is where all the minerals are deposited. So vitamin C actually stimulates collagen synthesis and is necessary later on in the process in order to do that weaving. So even if you have good minerals, even if you have good amounts of calcium and magnesium, if you don't have enough vitamin C, you won't be able to make bone or skin. Now, bone isn't just about vitamin C. It isn't just about calcium. And one of the other myths that is commonly propagated in America, I don't know about here, is that people need so much calcium. Children need calcium. Postmenopausal women need so much calcium. Well, what I found in my career was that we're not doing people any big favors by giving them all this calcium, because it's going to places where you don't want it. It's going into the heart, it's going into blood vessels, it's depositing in brain. So what has to happen is lower amounts of calcium need to be taken into the body, and then the molecules that tell the calcium where to go and tell the minerals where to go have to be brought in as well. Then everything works beautifully like it was designed. So we know we need vitamin C, but we also need vitamin D, obviously, and I know anyone living up in this area is well aware of the need for vitamin D. Vitamin K2 is one of the two normal forms of vitamin K that tells calcium where to go in the bone. Other B vitamins are also extremely important. Trace minerals have to be there in order to make strong bone. And so a good healthy diet that keeps that easily maintains a neutral pH in the body is important. So if I'm eating a diet that's full of, say I'm living on bacon and soda or Coca-Cola, I'm going to be generating a lot of acid in my body. And if I can't get rid of that acid through breathing or through urine, my bone will start to buffer it, okay? So everyone's nodding, so we get that. The diet is very important, well-rounded diet. There's never a time where I say there is a primal panacea and it is a supplement. It's not. It's always, there's always multifaceted approaches to staying healthy. So this is a short list of conditions that require vitamin C, that there is adequate medical literature to support. But my slides got a little too complicated when I started putting in all these numbers, so I'm just going to read them off for you for now. Is that I have a study later that's going to tell you more about this, but vitamin C is antiseptic. It's antibacterial. You can put it on skin infections, it will improve. You take it internally, it will improve. You can put it on your gums. If you have gum infections, it will improve. So it's directly kills bacteria and viruses as well. It's been shown to be helpful in conditions in intensive care units, severe infections, and sepsis. We see people's survival improved, and we know exactly why, because this systemic inflammatory response is the biggest problem in sepsis, and why the blood pressure drops, and why the fluid comes in the lungs. It's helped enormously by vitamin C. Trauma surgery and burns. There's literature that shows that giving high doses of vitamin C to burn victims lowers the amounts of fluid that they need, lowers the amounts of infections, secondary infections that they have, and is enormously helpful. The processing of normal toxins that are made in the body every day. I talked about blood vessels. I talked about histamine. Whooping cough is the place that I use the most vitamin C, because I find this is an illness that not only does the vaccine not work for, that 86% of cases of whooping cough are in fully vaccinated children, and many people catch their whooping cough from vaccinated children. So this is an illness that, whether you're vaccinated or not, occurs. And there's antibiotics do not change the cough, except often will make it worse because you're impairing the immunity. And doctors have nothing to offer, and so out of desperation they offer antibiotics, which tends to make everything get worse. And parents will call me and say, I didn't want to take the antibiotic, but I did, and now my child is worse. What can I do? And so we start them on very high doses of vitamin C. Even little babies. I've treated a 2-week-old baby with vitamin C. That baby is now 1 year and a half old. He's perfectly healthy and happy. So I've treated 64-year-old people with vitamin C for whooping cough. So every age group needs it with whooping cough, because whooping cough is a toxin-producing bacteria. And any illness that makes a toxin needs to be neutralized. The toxin creates oxidative stress, which is an electron thief, and vitamin C gives it back. Also, it strengthens the lungs, it strengthens the fibers in the eye so that people that are coughing don't get these hemorrhages in the eyes. And I have never had a secondary infection in any of my babies or children that have been treated with vitamin C. Mothers always say, but I heard about the secondary infection. I just say, I have not seen it. I know I've read about it in literature. I hear about it in kids who are given antibiotics. I have not seen secondary infections in my patients. You need enormous amounts. People get very nervous with the amounts of vitamin C that are required in these babies. But if you were to check the blood levels in these babies, you would see that even giving these very high doses is not raising their blood levels significantly, because the toxin is consuming the vitamin C very, very rapidly. Okay. Reactions This can also be very helpful because of cause inflammation, and whether you love to admit that it's part and parcel with vascular response that is considered necessary. In addition to that, contain aluminium, and aluminium is highly toxic metal that when injected into a muscle is very inflammatory and problematic and produces a lot of oxidative stress. And so vitamin C is very helpful after vaccine reaction. Well, I'll start by saying I'm pleasantly surprised at the warm reception I've received here. And I thought I was coming to talk about vitamin C, and I could not really talk much about my other medical heresy. But I would like to tell you how I got to where I am today, and because somebody requested that I give a little of my history of how I became the how should I say, outside of the box doctor that I am today. I started just like most other doctors start, which was very idealistic. I wanted to be a doctor and go to medical school and help people, and so I went to university and I got my degree in physics, and then I worked in a biomedical laboratory for 2 years, doing many experiments on animals, and then I decided that I wanted to work with people. So I went to medical school, and I graduated and had the happiest day of my life at my graduation from medical school, and then I went on to my residency where we study for 3 years. And at the end of that, I started to see some problems, which was that I became a highly sophisticated technician to hunt down disease and write prescriptions for all of my problems that I found. And that was about all I knew how to do. And this felt problematic to me. So I went and decided to specialize and learn more, and did 2 more years in kidneys, thinking that at least that these patients really needed the drugs and they really needed this specialty care. And I felt that I was doing a lot of harm to otherwise healthy patients by making them worry about things and have to have all these tests and all these drugs that I didn't really believe in. So I went into nephrology, and I taught medical students, I taught residents and full doctors, and I was in an academic situation. First was at a university setting for 2 years, and then I went 10 years, partly academic and partly private practice up in Maine. And during that period, I became increasingly unhappy with the narrow window that I was expected to stay within as far as what I could recommend for my patients, because I started to understand about oxidative stress, and I started to understand about vitamin D and vitamin C and nutrition and all these things that to me made much more sense to start with. But it was frowned upon by my colleagues, although some people referred patients to me just because I had that view. So it was very mixed. But there was a period in 2009 where several people came in after having swine flu, and then after the vaccine they had no kidney function and they needed to have dialysis. And I tried to tell my colleagues, I think there's a problem here with this, and I was met with such huge resistance that the irony is that that is what landed me here today. That had they said what they say for every other drug, if I give a statin and there's kidney failure, I give an antibiotic, there's kidney failure, they say, oh, of course, it's the drug, it's kidney failure, we stopped the drug. But when it came to that, it was completely different. And I kept hearing these doctors say to me, no, it's not, they're safe and effective, and they're necessary, and you can give them to everybody, whether they have kidney failure or heart failure or sepsis, because the benefit outweighs the risk. And to me, it was completely intuitively wrong. And so I started looking at my patients over time after they would have nation, and I asked every new patient I saw, when was your last? And at some point, I started to see that there was some correlation between the development of protein in the urine, or worsening protein in the urine, or high blood pressure, or autoimmune diseases, sometimes new autoimmune diseases, or worsening of old autoimmune diseases. And I was continually told, it's not the shut up. And so I started to do more intensive research, and I wanted to see the answers to these things I was being told. Okay, so I was told smallpox was eradicated by, and I thought, well, I always believed that to be true. Remember, I worked in the conventional system. I was told all the same things these doctors were told. The only difference between them and me is that I went and looked for myself, and I found answers that turned my world upside down, literally, to the point that I was making $300,000 a year in my job and very happy, to the point where I said I was so alarmed at what was happening, at what these doctors were doing, and what they were continuing to believe despite the evidence, that I left. And I walked away from all of it. And I do this now. I study 6 to 12 hours every day, 7 days per week, doing this, as these people I'm staying with can verify, that it's what I just feel I have to do it. And it's not work to me, because it feels like something that I've just been called to do. And so this book came out of my research with Roman Bystrionic. And what we discovered was that not only did it get rid of smallpox, but it did not get rid of polio. And we also wrote about measles and pertussis and whooping cough in there. And we found, much to the contrary of what the public is always told, that are what decreased the death rate, when in fact stopping smallpox stopped the death rates and the diseases in a town called Leicester, UK, which you can read about in the book. It's very interesting. That smallpox could not have possibly been eradicated by that, because only 5 to 10% of the entire world was ever infected. It was sanitation. So we have more to thank our plumbers for, and our trash collectors for our good health, than we do the medical system or vaccine. And we show that, and we prove it in the book. And since then, I've looked more intensely at the infant program. And that is even more frightening, because these infants, we are giving them more beans, we're giving them aluminium, which is highly neurotoxic. And all the while we're seeing in the United States, 1 in 6 children with chronic disability, 1 in 58 with autism. And we're told that it's environmental, but we don't know what in the environment. And any parent who watched their child go autistic knows it is not environmental. And there's plenty of science to the contrary that is just environmental, the environment is what's being injected around the cells of these babies' bodies. That's the environment. So anyway, so this is what I do now as full-time research. I have a small private practice, and I just go around talking to people who are interested to hear the problems with the conventional medical paradigm, and vitamin C as well, and then nation. So that's the history. It's a little easier in the United States to be a doctor like me, because there are more of us that have stepped out and disagreed with the army of doctors that are doing the things they're doing. So I hope that there will be more doctors in the other parts of the world that can see that it can be harmful to your career to step out, but the reward of being able to sleep at night and knowing that many people will benefit from what you've done, whether or not you're able to maintain your good standing, is worth it. If you Google my name, you'll see that I am considered a crazy person in the United States, despite the fact that I've studied more about these subjects than any of the people that are calling me crazy person, that my patients have done nothing but get better over time rather than get worse. So if that's what crazy doctors do, then I'm happy to be among the ranks of quackery. We do have a really interesting study that came out this year in 2014. And sepsis, evidence for IV sodium ascorbate. Now, I'm often called by people that say, you know, my father is in hospital, my mother is in hospital, they're having this problem, and I want them to give vitamin C, and they won't because they say it's dangerous or there's no evidence. And so I take this article, and this is free. You can get this online. And I say, you need to bring this in, because if they can say that is no longer safe, then they're just making it up now. Because what they did with this trial is they had this was just a phase 1 trial, and it called for a phase 2 trial when they got the results, which were very good. So they took patients with all these horrible diseases, underlying diseases like liver failure, kidney failure, lung failure, like total organ failure, cancer, bone marrow transplant, hepatitis, the kind of liver failure that makes you bleed through the esophagus, all kinds of problems. And these patients all had severe infections. And what they wanted to know was it safe to give high dose or low dose vitamin C to these patients, and what would be the outcome? Now, we're commonly told that if you have kidney failure, you cannot take vitamin C. But if you're dying of sepsis in a hospital, you have to look at it rationally, that if it can save the life, then you put them on dialysis for a while, you save their life, and then they will come off of dialysis. And that's essentially what happens when these patients get sepsis and kidney failure. Most of them come off of dialysis at some point. So give them the vitamin C, and that's exactly what they found. This is one of the charts from the study. So what they did is they gave 1/3 of the patients no vitamin C. They gave 1/3 of the patients 50 milligram per kilogram within 24 hours intravenous. And they gave other one they call high ascorbate, which I don't really call high, but they did, 200 milligram per kilogram in 24 hours, which equaled around 14 grams in the day. Now, I would have probably given them 100 grams in a day, but it's a start, and they had an interesting result. This is called a SOFA score, Sequential Organ Failure Assessment Score. It takes into account the Glasgow Coma Scale, different vital signs and organ function, and it's highly accurate indicator of death during critical illness. So if you have a high SOFA score in first 48 hours of intensive care unit, then your mortality rate is at least 50%. Okay, so you really want this score to be coming down very rapidly. And they admit in this paper that all the things they've tried over the years have not really done very much for this. So they said, let's try the vitamin C. Well, you can see the placebo that got no vitamin C, their SOFA score rose very bad. The low dose, you can see the SOFA score went down significantly, and the high dose went down even more significantly. And I would take an educated guess and say that if they got the 100 gram dose that I would have given, that we would have seen it even more come down more rapidly, especially if they gave it as quickly as possible on admission to the hospital. And so the conclusion of this paper says that no patient in the low or high dose ascorbic acid treatment arms suffered any identifiable adverse event. So we know it's safe because we were able to give it to these gravely ill patients who would have otherwise had a very high mortality rate. And we know that a very sensitive indicator of death went down rapidly. That's extremely significant, and this should be enough to have a doctor in a hospital give intravenous vitamin C when it's required. If that doctor is afraid of being sued, all they have to do is show this evidence. Here it is. There are other diseases that vitamin C has had powerful effects upon. And this is some of these are documented in books. Some of them are in medical literature. They're very easy to find. The evidence for polio was Dr. Klenner, who cured 100% of his polio patients by giving vitamin C. And when he announced this at an international doctors conference, not a word was spoken. He was basically completely ignored. I think they just didn't know what to do with him. Nobody believed it, and so nobody tried it. Because polio, remember, was a disease that was crippling children and could only be stopped by injection. Although it was actually a very low incidence disease compared to many of the diseases we see today and over the ages. Hepatitis is very helpful, that vitamin C, because, and this has been shown for all kinds of hepatitis, because toxins build up, because the liver is a detoxifying organ, and if it's not working properly, the toxins build up greatly. And if you give vitamin C, the liver function improves greatly. Viral encephalitis, rheumatic fever, mushroom poisoning was written by Dr. Klenner as well. Ebola, this is a big fear today. Well, I have an article here in my computer that shows these series of patients that were treated in Africa. And they were treated with all different, it was kind of almost seemed random how they decided what to do for each patient. But the ones that were given vitamin C survived, and they did better. And it makes sense because Ebola is a hemorrhagic toxin-producing virus, okay? Any hemorrhagic disease, think about it, it's little blood vessels breaking apart, causing hemorrhage. So it's scurvy. So you want to give vitamin C. So all this calling for VICT is going to be a disaster. And what should be done is that these people should be given hydration, because that decreases mortality by 50% just by giving them intravenous fluids and vitamin C. Colloidal silver has also been shown by U.S. government research that's published online to be toxic to Ebola virus. So we have several treatments, but when you hear the World Health Organization, they tell you that there's no treatment and it's highly deadly disease and we need this vaccine. So tuberculosis, we have an article from 2013 that showed that vitamin C is highly toxic to the tubercular bacillus and infectious mononucleosis. And there's many, many others. Dr. Levy also wrote a book called Primal Panacea that has over 300 references and whole sections on different diseases that have been treated with vitamin C. One of the things that Finland asked me to do was to do a talk on tetanus. And so I spent several months this summer preparing that. And I'm just pulling out one part of it for you to show you. And that is that there was a study done in Bangladesh by Dr. Jahan. And what they did is they got 117 human beings with tetanus. It's usually very high mortality in Bangladesh. And they divided them in two groups, and they gave all of them conventional treatment, okay, just like you would do for anyone with tetanus. But half of them, they gave 1,000 milligrams intravenously every day of vitamin C. And here's what we see. It didn't matter the size or the age. They gave everybody the same dose, unfortunately, because it was not in milligram per kilogram. Everybody just got 1,000. So the children got relatively higher dose than the adults. And we'll see the results of this is that this is the vitamin C group. There were 31 children between 1 to 12 ages. They all recovered. None of them died. In the no vitamin C group, there were 31 patients. 8 recovered, 74.2% died. Now, if we look at the adults between 13 and 30 years, remember these are bigger bodies, it's getting the same dose, we see 37% mortality in the vitamin C group, 67% mortality in the no vitamin C group, and to me this is a no-brainer that had they given a milligram per kilogram dosing high enough, I think they could have saved most, if not all, of these people in the second row. So this is evidence that if anybody has a wound, even whether you think it could have tetanus or not, all wounds are susceptible to tetanus. And even if you're still developing tetanus. So every wound should be treated rapidly insofar as cleaning it, letting it bleed, applying antimicrobial like colloidal silver. I put vitamin C right on the wound, and I start dosing with vitamin C right away. Because there's also an animal study that showed that at any stage that you give vitamin C to an animal, whether they have developed symptoms or whether they have not yet developed symptoms, that you decrease the mortality, the death rate to 0. Whereas if you do no vitamin C, the mortality rate, they all will die. So right away, I start dosing with vitamin C with any wound, and I am very aggressive with cleaning it, getting rid of dead tissue, and removing dirt. Okay, so that's very helpful in anyone who is concerned about tetanus. Okay, now to a more practical aspect. The foods are always primary number one place to go for health. And you call this paprika, I believe. We call them red pepper in USA. But they are very high in vitamin C. 300 milligrams in one fruit is very high. So I love them, so that's good. Parsley, 133 milligram in 100 grams. So between these two items, you can get a lot of vitamin C in one day. And then you've got broccoli, kiwi fruits we already talked about, 140 milligrams in 2 kiwi fruits, and I think I could probably eat 10 in one sitting, so that would be plenty for a day. And then we've got tomatoes and citrus fruits, berries. You eat a lot of berries up here, and that's probably one of the main sources of vitamin C that you're getting. And you can taste how tart the berries are, and that's ascorbic acid you're tasting in there. And it also has all these flavones that I talked about before that takes the metals out and preserves the vitamin C longer. So food is always really good to have. But if you're very sick, you would need to fill this. You need to fill up, several baskets of with this food, and you could never eat enough when you're acutely ill. But I think juicing, you can get quite a good amount, but then you have the sugar to deal with in some cases, and sugar competes with vitamin C on the cell. So you want to have a low sugar, low carbohydrate intake when you're wanting to get a lot of vitamin C in the body. So these, I talked about the flavonoids, and so you can add these things to your other vitamin C containing foods, and together they will be synergistic. And dark chocolate that's the good news, is that there's lots of good things about it. Bananas, all citrus, berries, onions, parsley, and all these teas. So they all have these flavonoids which act synergistically with vitamin C. Now there are some people that really don't want to give a vitamin C that was made by pharmaceutical companies. So they say to me, can I just give something natural? We have all these natural forms like camu camu and rose hips and acerola. And my answer is sure. That will give you around 250 to 500 milligrams in 1 teaspoon. That's about 1/10 of what you will get by the synthetic form. So if you're just having a little mild illness and you only want to do natural, then food plus this, it may be enough. But if you want to treat whooping cough, you'll never do it with this. It'd be very, very difficult. I won't say never, but it'd be much more difficult. You probably would have to take the whole jar over 2 or 3 days. You need that much vitamin C when you're dealing with sepsis and whooping cough. And these other more serious toxin-producing illnesses. But there's nothing wrong with this, and perfectly fine to do this. Then this is sodium ascorbate, and this is the lipospheric, and these are the two that I think every household should have. This is very good to give to babies because it's just easy to swab inside of the mouth, and it gives them rapid absorption and high blood levels. It's also good to give to people who are very debilitated and ill because you can bring this into the body without using a lot of energy, because it comes right into the body almost like a solvent comes in. So let's get on to the question of, do we just make expensive urine? And it's a complete waste of time to take high doses, because this is something you will hear, and people will be very emphatic and very certain about this. So you can take a picture here and show it to them. But this came from a conventional medical doctor, Dr. Levine in the USA, who's done a lot of the research in National Institutes of Health. And what they show is that if you take 100 milligrams, it's 80% bioavailable, so you'll absorb 80 milligrams. So low doses, when you have high need, you'll absorb a lot of it. If you take 1,250 milligrams, it only becomes 46% bioavailable. So in a sense, they're right, whereas it's less bioavailable when you take more. But look, you're absorbing 575 milligrams. So you're still getting a much, much higher dose into your body, even though you're going to be relatively more spilling into the urine. But that's okay if you spill vitamin C into the urine, because it's actually good for the bladder and actually can decrease urinary infections. And there's some evidence that it can decrease kidney stones. We'll get to the kidney stones in a minute. So don't worry about spilling vitamin C into the urine, because it's healthy for the urinary tract. And you have to be smart about it. If you're somebody that tends to form kidney stones, I'll talk about that in a moment. So that's the oral bioavailability. If you're giving intravenous, it's 100% bioavailable. So how long does it last in the body, and how high of levels can we get? Here we see this is 1 dose of 1,250 milligrams sodium ascorbate powder. And this is 36 grams of oral lipospheric. It's basically a whole box. It's a huge, enormous dose, which I do not recommend that you take. But this was done on human volunteers just to see how high could we get their blood levels. Because the NIH said that we really can only get the blood levels up around 70. Well, they were wrong. The NIH gave one dose, and then they waited till here to check, when they didn't realize that even with a small dose, you're getting an increase in the level. And during that time, when you have an increase in the blood, all those organs that like to hold on to vitamin C will grab it before it goes out in the urine. So your scurvy in your heart has a chance to grab some of this vitamin C while the levels are high. Your eyes and your kidneys have a chance to grab it while the levels are high, and then it drops down. But NIH measured it here and said, oh, well, all we can get is 70, and that's all there is to it. And they measured white blood cells, which is unfair because white blood cells have pumps that hoard vitamin C. So it was an unfair experiment to make these assumptions. So we now know that with just a small dose, we can get that level of 150. And if you have the flu or a cold, you can take another dose here, and you can continue to maintain that higher dose in your body. And if you didn't take 36 packs of liposomal, say you just took 2 or 3 at a time, you probably would be up around here and maintaining this. So that's what we can do with the oral vitamin C that we have at hand, and it's the most useful, and it's what our bodies need most when we're in need of treatment for acute diseases or chronic diseases. I don't believe we need intravenous vitamin C for all but a few different illnesses. I usually take around maybe 2 to 4 grams on a regular day when I'm traveling and, airplane flights and trains and, doing talks like this. I find I can tolerate 20 to 30 grams in a day. And so it's really variable depending on stress level. Remember, stress can be emotional, psychological, physical, toxin, many ways to create the exact same phenomenon in the body. If you have a high carbohydrate intake, it'll make it seem as though you can't tolerate as much vitamin C. So remember that. If one day you take it and you seem fine, and the next day you take it and you have diarrhea, think back on what you ate during that period and you may get the answer. Also, having unhealthy bowel bacteria can make it seem like you can't tolerate as much. So it's always good. All of my patients, the first thing I do is I deal with the bowel. The bowel is of number one importance because most of the time they have been insulted by numerous antibiotics and a terrible diet. And so the bowel, always number one. And there's evidence that vitamin C actually feeds the healthy bacteria and kills the toxin-producing bacteria. They actually use sodium ascorbate in the sausage industry just for that, because sausage is essentially fermented and it can have E. coli growing. And they find that with sodium ascorbate, the fermenting bacteria thrive and the E. coli go down. So if anyone's worried about killing off their healthy bacteria, it's just not what happens. Lactobacillus tends to thrive in the setting of ascorbate. Okay, so in general, adults around 2 to 3 grams are tolerated very well without any adverse effects or diarrhea. Now, there's always an exception, but probably everyone in this room can tolerate 1 gram in the morning, 1 gram in the evening. I kind of align more with his dose recommendation, which he says somewhere between 500 milligrams to 20,000 milligrams, depending on many factors. And a lot of the research that showed the improvement in the status of heart arteries and cholesterol really only showed around 500 milligrams per day. Dr. Levy says 2,000 milligrams a day is minimum of what you should have if you want to deal with atherosclerosis and these kinds of problems. But again, I think individual dosing really depends on a lot of factors that should be taken into account, as well as your baseline status, your diet, and your stress level. So my suggestions on daily use of sodium ascorbate is that if you're a healthy person and you're stress-free and you have minimal toxin exposure and you eat a lot of organic fresh produce, that you don't need a supplement at all. But hardly anybody falls into that category. And I mean, I fell into this category last summer when I was, more relaxed and in a place where there were trees and gardens everywhere, and we were able to get it right off the plant. And it was fine because I was probably getting somewhere around 500 to 1,000 of whole vitamin C just in the diet, and I didn't need very much. So if you have chronic illness, you'll need higher doses. Other indications for everyday use would be toxin exposure, radiation, pollution, chemicals. Anyone who drinks more than, I'd say, 1 drink per day probably should be supplementing or eating a very high vitamin C diet. Smoking, drugs. Constipation is, in my opinion, is a sign that there could be vitamin C deficiency. And it's always helped by vitamin C. So people strive, to get their kids to move their bowels, and they try giving them prunes and they hate it, and psyllium and all these things, which is fine, but add a little bit of vitamin C and see what happens. It's very effective. Again, travel, I mentioned. Travel it's very toxic to travel in many ways. And when I used to travel, I would almost always get sick. And I would be sick for, between 3 days and 2 weeks, and sometimes would take me 3 weeks to get really normal again. And now I just feel a little bit of something coming on, and I take 1 pack of liposomal and several larger doses of sodium ascorbate, and within hours the symptoms are gone and I don't get sick. And this happens over and over and over again. So I am testament to the good effects of vitamin C when traveling. I never travel without it. So this is the multivitamin C protocol that Dr. Levy talks about in his book, Death by Calcium, I believe is where he mentioned this. It's a very good book. And so he talks about taking the liposomal, the multi-sodium ascorbate. We've already talked about most of this. The ascorbyl palmitate and the intravenous. And those are the benefits to each particular kind. We talked about how easy it is to bring in the liposomal into the body. We talked about the bowel decontamination with sodium ascorbate and the high levels you can get both in the cell and outside of the cell with intravenous sodium ascorbate. So a lot of people say, well, why not ester C? Because calcium is so good for me, and ester C is buffered, and that's what's on all the shelves, so it must be good. And I just hold my head and say, how can this be another area where everybody has the wrong information? But it is the wrong information. Ester C is calcium ascorbate. Most people in the world are taking in too much calcium, and they're not taking in the elements that tell that calcium where to go. And that's the problem. It's not that we don't get enough calcium. So if you're sick, and all you've got in the house is calcium ascorbate, then go ahead and take it. But if you want a daily supplement, this is not, in my opinion, what you should be doing every day, taking in this calcium. I wrote to Dr. Levy and I asked him, well, what about growing kids and babies? And he said that nobody needs more than 400 milligrams a day, unless you're a lactating woman. I think there's one other stipulation, or last trimester of pregnancy, you would need twice that. So if you're going to take ester C and you need a 4-gram dose, let's say, then you're going to be getting 400 milligrams just in that one dose. I mentioned before that in order to bring the vitamin C into the body, that you need to have the sodiums, because the transporter, it's like a little wheel, is how they basically show it, and you have to bring in 2 sodiums with each ascorbate. And so it's physiologic. It's what the body wants, is the sodium with it. And people say, well, we love ester C because it's buffered. Well, the pH of sodium ascorbate is around 7, so it's buffered too. Your pH is 7.4, so it's not that far different from your own pH. This is like a less of a problem, but in order to make the ester C requires high heat, and you can make the used up portion will be higher in the supplement. So this information is available in Dr. Levy's book, Death by Calcium, and this paper by Dr. Seeley from 1991. Also, those were used together with Dr. Levy's writing. So, true calcium requirements. This is right from Dr. Levy's book, age 0 to 15, no more than 400 milligrams per day. age 15 to 35, 325 milligrams, and then so on, older 220, 170. And then the exceptions are the women in last trimester and lactating women, because obviously the growing fetus is taking not only the vitamin C but the calcium, and the milk is some calcium is leaving as well. So the mother is going to be depleted if she's not taking in something. This is an interesting paper by Dr. Seeley from 1991, and it just showed that the death from heart disease and milk protein consumption, that did not include cheese. It was basically, I guess, milk and cream. And they looked at the male, these were the older males, the younger males they looked at too, and had the same trend. But you can see that Finland this is a rate per 100,000 death and milk intake, and you can see that Japan did the best because they don't drink, at least then, were not drinking very much milk and had a low heart death rate in their men. You can see Sweden is higher and Finland is even higher, and USA was down here. It's still all very high compared to this lower group here. And it's probably not just the milk. It's probably not just that, because these cultures and their diets are all different. But it's something to think about in terms of that we know that high calcium diets don't go into the bone necessarily. Okay, so safety. And I think this is probably a very strong argument in favor of vitamin C. Yet we hear constantly over and over and over that vitamin C treatment is quackery and that it's potentially dangerous. And I've been attacked publicly online and for my writing about this, saying that I am putting the public health at risk by recommending vitamin C. And my answer to that is that there are no reports of healthy people overdosing or dying on vitamin C, and that 227 gram ingestion in an adult would survive per the pharmacology literature. Now let's go over to the common over-the-counter drugs and have a look. The things that these same people that are accusing me of causing public health problems are prescribing like candy to everybody. We see 3 to 28% of hospitalizations per year due to adverse drug events in USA. We see 0.31% of them die. 380 people per day are dying in the United States because of over-the-counter drug ingestion. Paracetamol is something you're all well familiar with. It's something that's said to be good for everybody and should be used for fever treatment. My opinion is that fever treatment should never be treated with something that just lowers the fever. You're completely going against nature's most valuable mechanism to protect you, and you're, basically shooting the attack dog because it's barking. You don't want to do that. So paracetamol in USA, 56,000 emergency room visits, 26,000 hospitalizations, 450 deaths per year from an unintentional overdose. Then we have these non-steroidal anti-inflammatory agents that are used in a lot of older people. And these people are developing ulcers. 41,000 hospitalizations per year and 350,000 days in hospital, 3,300 deaths per year from these drugs. Now, the real irony, in my opinion, is that vitamin C is a helpful treatment for these ulcers, that it kills Helicobacter pylori, and that it helps the new tissue grow. So not only are these people that are attacking the need and safety of vitamin C putting their own patients at risk with these drugs, but they're overlooking a valuable intervention that can help with fevers in children because it fuels the immune system. It fuels the white blood cells to do the job they're trying to do when that fever calls them to work. So vitamin C is helpful for these problems. It actually helps reverse liver damage and prevent liver damage and detoxify the liver in the setting of cirrhosis. This is conventional medical literature right there. There's something called an LD50, and that is the lethal dose lethal dose required to kill half of the members of a tested population. So the higher your LD50, the more safe your substance is, and the lower your LD50, the less safe it is. So you can see this is the dose in milligrams per kilogram of weight. And look where aspirin falls, 200. And look where paracetamol falls, 1944. And look where vitamin C falls. Hey, the pharmacology is the pharmacology. So if you're met with this kind of uneducated resistance, these are the things to reply with. Okay, so let's talk about kidney stones, because I'm a nephrologist, I'm a kidney doctor, I see lots of kidney stones, and I don't take them lightly. They're extraordinarily painful. Women who have had kidney stones and natural childbirth say they would rather have natural childbirth. So we don't want people to develop kidney stones. They can destroy the urinary system, can cause kidney failure, and it's not a situation you want to provoke by any means. You'll find literature that says vitamin C does make stones, and you'll find literature that says it doesn't. I believe that there's more evidence and clinical proof that it doesn't than there is that it does. And I believe there are things we can do in people who tend to form stones to prevent this problem. I've really combed through the medical literature looking at the stone literature because I thought, if this is a problem, I need to tell people to be careful. And what I find is that there's a rare case report that tells of a person that came into the hospital dehydrated, and then they give a history of taking vitamin C. Then they do a biopsy of the kidney and they find oxalate. So I think this probably could happen. The question is, are these people have a primary disease that makes them make more oxalate, which can happen. But either way, you don't want it to happen. So if you're dehydrated, get hydrated first before you take a big dose of vitamin C, unless you're in a life-threatening situation. The problem is that 3/4 of kidney stones are about 3/4, and sometimes it can be a little higher than that, are made of calcium oxalate. And this oxalate can form as a byproduct. It's one of the end products of vitamin C metabolism. But there was a good study by Dr. Wanzelak in 1994, because before that there was a lot of hype about how this oxalate was forming huge amounts in people who were taking vitamin C. And so what this doctor noticed was that what was coming out in the urine was actually vitamin C, but it was turning into oxalate in the specimen dish. And it had to do with also how they were doing the analysis, that it was turning to oxalate in that analysis. So he decided to give people doses up to 10 grams per day and look to see if these people are making more oxalate in the urine or not. And he found that it was only about 1% of the urinary ascorbic acid turned to oxalate. And he said there's no genuine increase in urine oxalate despite a greatly increased ascorbate intake, okay? There are many doctors that are stating the anti-stone forming properties of vitamin C. And Dr. Cathcart is one of them, and he talks about that he started using vitamin C in very high doses, 200, 300 grams in people, back in 1969. And he said later he read that ascorbate could cause kidney stones, but by then he already had all this clinical evidence that it didn't. And so he continued prescribing massive doses to his patients. And he said that by 2006, he put 25,000 patients on massive doses of vitamin C, and none of them developed kidney stones. He said 2 of them went down on their doses to 500 milligrams and developed a kidney stone. But once he put their dose back up again, they had no more problems. He also added magnesium and vitamin B6 to their program. And he said he thinks they developed the stones because their dose was actually too low. Ascorbate in the urine actually will bind calcium that can turn into calcium oxalate. So there may be a benefit of having it from that standpoint. Very high doses of ascorbate is actually a bit of a diuretic and will increase the urinary flow. And remember, silt forms where there's not very much flow. So if you have high flow in a system with a lot of water, you'll know that crystals just do not form as easily. So you need concentration, you need the proper chemistry, and you need low flow to make these stones. Also, ascorbate in the urine kills bacteria, and for that reason, the kind of stones that form in infected urine, there are some that are called struvite, that they can be limited by having ascorbate in the urine. So there are actually benefits to having vitamin C if you're a stone former. But again, I believe that we have to be smart about it. And I say that there's caution warranted if you're dehydrated, if you have low urine flow. So I like to see the urine flow around, in an adult, maybe at least 1 liter per day, ideally, when you're doing a lot of vitamin C, maybe 1.5 or 2. If you have a known tendency to form stones, then again, drink a lot of water first and continue drinking it while you're taking the vitamin C. And you can even squeeze some lemon into the water, which gives you citrate. And citrate is a natural stone inhibitor. We use it. There's a urologist in the audience who confirm that we use this in drug form, actually, sometimes. It's very, very successful at stopping stone formation in stone formers. And you can get that just by squeezing a lemon. So we use that a lot in nephrology and urology. Instead of prescribing a drug, we just tell people, put half a lemon in a liter of water, and that will help you. And we've actually seen pH of the urine go up that way. It's very, very effective preventing stones. If you have less than 20% of your what's called glomerular filtration, you want to be careful. It doesn't mean you can't take any vitamin C. It just means that if you're sick and your body's going to use it, then maybe you can tolerate more, but you're still probably going to have higher oxalate levels. If you're on dialysis, probably just take a small dose before dialysis, let it do its work, and then the oxalate will be removed. So my advice is always, it's just good to stay hydrated with good quality. If you can have alkaline water, but if not, just good quality, clean water all the time, because our bodies are largely water, and so that's what we're made of. We want to have good water in the body, and we want to keep the urine flow up high enough, especially if you're taking vitamin C. Add the lemon to the water if you think you have a tendency to form a stone, or if you're dehydrated and you're concerned that could be a problem, keep going with the lemon. Lemon is just so good for you in so many ways. Consider the real risk factor for kidney stones. Again, allopathic medicine, hammer, nail, oxalate, kidney stone. It's not that simple. People's diet has a huge impact on kidney stone formation. People who tend to drink lots of soda and eat junk food and have high fructose corn syrup and lots of sugar tend to form more stones. If there's a lack of citrate in the diet, citrate comes in your citrus fruits is where you find a lot of it. And then the urine pH can be changed according to what kind of stone you make, but putting the lemon in the water is very, very helpful. The water can cure so many of the problems that people go to doctors for, headaches, even some ulcers. There are just so many things that water alone can do for you. This is my last slide, and I'm told this actually by people that are on my side. Often people will write to me and they're into health and they understand that allopathic medicine is problematic, and they tell me that I'm actually giving bad advice because I'm telling people to take synthetic vitamin C, and I'm told that it doesn't cure scurvy. And at first I thought, oh no, I hope I'm not telling people the wrong thing. And then I sat down and thought about it, and I went back through the history, and I decided my answer to that is, well, if that's true, tell Dr. Frederick Klenner, Dr. Linus Pauling, Dr. Archie Kalokerinos, who was in Australia saving children's lives. They were dying. 1 in 2 children was dying after being vaccinated while they were ill. They were dying of sudden infant death syndrome. And it stopped. This epidemic of 1 in 2 children dying stopped by giving injections of synthetic vitamin C, sodium ascorbate. Tell Robert Cathcart, who has treated, 15,000 or something like that, people. Tell the hundreds of doctors and practitioners who are reversing disease with artificial vitamin C every day, including myself. the thousands of infants who are now growing up having survived whooping cough without lots of drama, without drugs, and now they're going to have upwards of 30 years of immunity because they had the natural disease. In 1936 even, doctors were describing that scurvy cases actually didn't respond to food sometimes, and that they only responded to intramuscular injections. So there's another study here showing these guinea pigs that were kept alive for 1 year on a flavonoid-free diet with synthetic ascorbate. So the proof is in the history. You know, it's good to eat food, like I keep saying, get the flavones, it's very good. But when you're using vitamin C this way, you're using it as a drug. And then, to me, it's a better drug than an antibiotic or than any other drug that starts with anti that's going to suppress a symptom, because this actually gets your body up and running the way it's supposed to be. And so L-ascorbic acid in the form of sodium ascorbate, ingested or injected, does cure scurvy. And with that, I will stop. Thank you. Thank you.